Welcome to Medicare Mondays. Today's segment is pre-recorded and we will be discussing original Medicare versus Medicare Advantage plans. Original Medicare versus Medicare Advantage. When you first enroll in Medicare and during certain times of the year, you can choose how to get your Medicare coverage. There are two main ways to get Medicare: Original Medicare and Medicare Advantage. With Original Medicare, you have Part A, Part B. You can add Part D prescription drug plan. You can also add a supplemental coverage. This includes Medicare Supplement Insurance or Medigap, or you can use coverage from a former employer or union or Medicaid. With Medicare Advantage, you have Part A, hospital coverage, Part B, doctor visits and preventative services. Most plans include Part D prescription drug plan, extra benefits, and some plans also include lower out-of-pocket costs. Original Medicare is the traditional fee-for-services program offered directly through the federal government. It is sometimes called traditional Medicare or fee-for-service Medicare. Original Medicare includes Medicare Part A, hospital insurance, and Part B, medical insurance. You can join a separate Medicare drug plan to get Medicare drug coverage, which is Part D. You can use any doctor or hospital that takes Medicare anywhere in the U.S. To help pay your out-of-pocket costs in Original Medicare, like your 20% coinsurance, you can also shop for and buy supplemental coverage. Medicare Advantage is a Medicare-approved plan from a private company that offers an alternative to Original Medicare for your health and drug coverage. These bundled plans include Part A, Part B, and usually Part D. They must provide the same benefits offered by Original Medicare but may apply different rules, costs, and restrictions. Medicare Advantage plans may also offer certain benefits that Original Medicare does not cover. Some of the most common types of plans are Health Maintenance Organizations or HMOs, Preferred Provider Organizations or PPOs, and Private Fee-for-Service PFFS. Beneficiary shows the membership card from their plan when receiving care. Do I need to get a referral before I can see an in-network specialist? With an HMO and a private fee-for-service plan, usually you do need a referral. With a preferred provider organization or PPO, you do not need a referral. Will the plan pay for care from a doctor or hospital that is not in the plan's network? With an HMO plan, no, unless you need urgent or emergency care or if you have a point of service POS option that allows you to use your out-of-network providers. With a preferred provider organization or PPO plan, yes, but you will pay more unless it is an emergency. With a private fee-for-service plan, the plan will pay for care from a doctor, but you will usually pay more and the provider must agree to treat you unless it is an emergency. With Original Medicare, you can go to any doctor or hospital that takes Medicare, anywhere in the U.S. Original Medicare covers most medically necessary services and supplies in hospitals, doctor's offices, and other healthcare facilities. Original Medicare doesn't cover some benefits like eye exams, most dental care, and routine exams. You can join a separate Medicare drug plan to get Medicare drug coverage or Part D. In most cases, you do not need approval for Original Medicare to cover your services or supplies. Original Medicare generally doesn't cover medical care outside of the U.S. You may be able to buy a Medicare supplemental insurance or Medigap policy that covers emergency care outside of the U.S. With Medicare Advantage plans, in many cases, you can only use doctors and other providers who are in the plan's network and service area for non-emergency care. Plans must cover all medically necessary services that Original Medicare covers. Plans may also offer some extra benefits that Original Medicare doesn't cover, like certain vision, hearing, and dental services. Medicare drug coverage, Part D, is included in most plans. In most types of Medicare Advantage plans, you can't join a separate Medicare drug plan. In many cases, you may need to get approval from your plan before it covers certain services or supplies. Plans generally don't cover medical care outside of the U.S. However, some plans may offer a supplemental benefit that covers emergency and urgently needed services when traveling outside of the U.S. With Original Medicare, you usually pay 20% of the Medicare approved amount for Part B covered services after you meet your deductible. This amount is called your coinsurance. You pay a premium monthly payment for Part B. If you choose to join a Medicare drug plan, you will pay a separate premium for your Medicare drug coverage or Part D. There is no yearly limit on what you pay out of pocket unless you have supplemental coverage like Medicare Supplemental Insurance or Medigap policy. You can choose to buy a Medigap to help pay your remaining out-of-pocket costs like your 20% coinsurance, or you can use coverage from a former employer or union or Medicaid. With Medicare Advantage plans, out-of-pocket costs vary. Plans may have lower or higher out-of-pocket costs for certain services. You may also have an additional premium. You pay the monthly Part B premium and may also have to pay the plan's premium. Some plans may have a zero monthly premium and may help pay all or part of your Part B premium. Most plans include Medicare drug coverage or Part D. Plans have a yearly limit on what you pay out of pocket for services Medicare Part A and Part B cover. Once you reach your plan's limit, you will pay nothing for services Part A and Part B covers for the rest of the year. $9,350 for most plans in 2025. With the Medicare Advantage plan, you can't buy a Medigap policy. Beware of misleading marketing. Medicare Advantage plans and Part D plans are administered, marketed, and sold by private companies. Plan representatives, agents, and brokers must follow federal guidelines on marketing to you. The following guidelines protect you from manipulative and deceptive sales and enrollment tactics. If you are comparing or enrolling in plans, here are some red flags to look out for. You signed up for a plan after being told by a company that certain services or prescriptions are covered, but after enrolling, you discover they were not covered by the plan. A company represents itself as coming from Medicare, Social Security, or Medicaid. If you receive an unsolicited phone call or text from a plan with which you have no prior relationship or have asked not to contact you. If an agent discusses other insurance products, such as life insurance, during a visit or meeting that was scheduled to only discuss a Part D or Medicare Advantage product. If a plan agent returns uninvited to your residence after missing an earlier appointment. If you need help with Medicare, contact any one of our community partners listed here. Agent Well in Woonsocket, Johnston Senior Center, West Bay Community Action Agency in Warwick, the South Kingstown Senior Center, Westerly Senior Center, Rhode Island Aging and Disability Resource Center, East Bay Community Action Agency in East Providence, the Leon Matthews Senior Center in Pawtucket, Progreso Latino in Central Falls, the Edward King House in Newport, or you can reach the Rhode Island SHIP and SMP line at 1-888-884-8721. Thank you for viewing this presentation. If you have any questions, please feel free to contact 1-888-884-8721, or you can reach Jennifer Reyes, SHIP and SMP Volunteer Coordinator, at jennifer.reyes@oha.ri.gov.